Hello students, I know you had a great exam. Now my best wishes for your result. In anesthesia, I got 7 questions, all were very predictable questions. I know most of my students must have scored 100% in anesthesia. So let us see the questions and their correct answers. The first question was from a predictable Malampati scoring. So Malampati scoring is used to assess difficulty for. So we have so many times discussed all the questions of Malampati and the same question was asked in exam. So Malampati scoring is used to assess difficulty for laryngoscopy and intubation. So let's see the option. Endotracheal tube insertion. Well, this seems the correct answer. So answer is endotracheal tube insertion. The other options were orogastric tube insertion, oropharyngeal airway insertion, nasopharyngeal airway insertion. Well, I don't know about these 3 and 4 option because these third and fourth, I mean, what I gathered from the student, only first and 2 options what I got. But I think why students are not remembering the options because the answer was very obvious and they just focused on the answer of the question. The answer is to predict difficulty in endotracheal intubation. Okay, next question. Most common intravenous anesthetic used for total intravenous anesthesia. So many times I have told you. Propofol, 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 right? For any surgery, we use today propofol if propofol is not contraindicated for that surgery. For total intravenous anesthesia, propofol is best. Why? Antiemetic, pleasant recovery, no context sensitivity time is very less. So go out of the body, eliminate it out of the body very fast. So propofol, propofol, propofol. So answer is propofol, right? So most common IV anesthetic agent, propofol. Next question. What does ASA grade 1 means? Well, again a very predictable question on ASA grading. So last time the question was asked on what does ASA grade 3 means? Now this time what does ASA grade 1 means? So we have discussed. ASA grade 1 means no systemic illness, a healthy patient, right? 2 means mild systemic illness, 3 means moderate to severe systemic illness, and 4 means incapacitating or life-threatening systemic illness. So 1 was asked and the answer is that healthy person or healthy patient. Next question. Which drug acts on NMDA receptor, N-methyl D-aspartate receptor? So many times I have told you that all inhalational and IV anesthetic, they act on GABA except ketamine, xenon and nitrous oxide, which acts on NMDA receptor. The most important drug acting on NMDA receptor or is an NMDA antagonist is ketamine. So ketamine is NMDA antagonist. Rest of the anesthetic agent, most of them are GABA agonist. Okay, next question. Again a very predictable question on CPR. So I told you last moment what you have to study before exam. 1 question sure shot from that topic is CPR. It has to come. So this time again a very simple question was asked. In adult resuscitation, when there is more than 1 rescuer, what is the ratio of compression and ventilation? So for adult, I have told you any number of rescuer, compression and ventilation is 30:2, right? For pediatric, if it's a single rescuer, 30:2 and multiple rescuer, 15:2, right? So for adult victim, for adult patient, the question was on adult. Right, question was on adult and it's always 30:2 compression ventilation ratio. Okay, next question. Topical anesthetic most commonly used for cataract surgery. A repeat question. It was asked in INI-CET and NEET and again a repeat question in your exam. So for cataract surgery, which hardly lasts for 20 minutes, we want to use a short acting one. The proparacaine is the commonest one which we are using. So proparacaine. This is the most commonly used for cataract surgery for topical anesthesia. The onset is very quick within 5 minutes and the duration is for 10 to 20 minutes. So that's why it is very suitable to be used for cataract surgery. So answer is proparacaine. Okay, next question. Which of the following drug is used for reversal of anesthesia? So a drug was asked which we use for reversal of anesthesia. Okay, for neuromuscular blocker which we use during anesthesia, we have luxury of having some reversal agent. Neostigmine is one such drug which helps in reversal. So in the option was neostigmine, atropine, glycopyrrolate, midazolam. Well, the 4th option I'm not sure because this is I added from my side. I didn't got the 4th option, but first 3 option number of students they confirmed that these were the options. So in this, the answer has to be neostigmine. Atropine or glucocorrelate we are using to counteract the muscarinic side effect of neostigmine. It is not helping us in reversing. The drug which is helping us in reversing anesthesia is neostigmine. So answer has to be neostigmine. So this was my 7th question. So these were the questions which came in anesthesia. If any other question you think is from my subject or related to my subject, please put it in the chat box. I will discuss that question also. Okay. So a very quick, the answers of all the question. Which drug is used for reversal of anesthesia? Neostigmine. Topical anesthesia most commonly used for cataract surgery? Proparacaine. In cardiac arrest, adult patient resuscitation, more than one victim available. What is the ratio of compression ventilation? 30:2. Which drug acts as an NMDA on NMDA receptor? Ketamine. Then what does ASA grade 1 means? Healthy patient or healthy person. What most common agent used for TIVA? Propofol. And Mallampati scoring is used for assessing the difficulty for endotracheal intubation. So I know all of you must have done every question, marked every question correctly. My best wishes. Thank you.